Let's take a look now at the updated coronavirus numbers from the state. Indiana state health officials report 60 more people have died. Those deaths happened between November 9th and November 17th. And as Julia mentioned, 4,830 Hoosier deaths are now linked to the pandemic. There are more than 6,100 new cases. In all, more than 268,000 people have tested positive. Meanwhile, healthcare workers around the state are feeling an enormous amount of pressure during the pandemic. Governor Eric Holcomb and medical professionals issuing a stern warning to Hoosiers tonight to wear their masks and practice social distancing. According to Dr. Christina Box, daily hospital admissions are at their highest level since the start of the pandemic. She says that she continues to hear about exhausted nurses and doctors and patients having to wait in the emergency department because there are no beds. A nurse joined the governor's press conference today to talk about the difficulties that she and her staff have been facing.
But this pandemic has stretched us and squeezed us in a way that we have never, ever experienced before. Like Dr. Fish shared, there are patients that unfortunately we can't meet their needs right now because we're inundated. We have an abundance of patients, more than we can quite frankly handle right now. And these patients are very, very hard to take care of.
Dr. Box says that people should not go to the emergency department to get tested. That should be reserved for people who have life-threatening symptoms. But you may run into some problems at the testing locations Dr. Box actually wants you to go to. Recently, people trying to get tested have reported difficulties finding an appointment, sometimes having to wait 2 to 3 days. Dr. Box says there are more people requesting a test and locations are struggling to keep up. Now, once you get tested, results are no longer taking 3 to 5 days. Now it's taking about 6 days to get your results back. Box says that the state is doing 55 to 60,000 tests a day, and labs are overwhelmed.
We are also looking to make sure that we are bringing on additional labs here in the state of Indiana so that we can divide and conquer the labs, the number of labs that we have. Honestly, there are some shortages of different materials, plastic materials that the labs need to run some of these labs. So it's really a juggling act similar to what we had early on with testing.
Dr. Box says the state is also looking into adding more testing sites and adding more lanes at current locations.